We're here today, we're discussing the opioid crisis. And I want to give you an example of how effective the Safe Babies Court team approach and these core components that I just spoke of can be in effecting change in response to such a crisis. Specifically here, to create real change quickly in our juvenile courts and child welfare systems approach to working with opioid-addicted parents. A year and a half ago, a parent overdosed in my courtroom after shooting up in the bathroom of the courthouse prior to the hearing. Not me, not the lawyers, not the child welfare caseworkers, or any other of the professionals in the room could read what was happening right in front of us. It took this parent's sister, who was also the custodian of this child we were working with, to interrupt our hearing, drag him out of the courtroom, and take him to the hospital. After we finished the hearing, I felt a lot of emotions. Embarrassment was one, anger was another. I realized from that experience that there is no way that we can help these families with a court and a child welfare agency that is ignorant of what we're dealing with. I mean, we could quote you chapter and verse on methamphetamine. We've been dealing with that for 30 years now. But the onslaught of opioid-addicted parents was a fairly new phenomenon to us. I learned that there was no consensus, let alone evidence-based knowledge among our child welfare caseworkers, our state's attorneys, or judges as to the methods of treatment for the opioid addiction, parents, and our child welfare system. I also learned that there was no relationship or even open line of communication between the child welfare agency and our primary opioid treatment center in the area. Primary, the only one in our area. I turned to our local Safe Babies Court team and the QIC for help, knowing that things would not change quickly any other way. In response, we got immediate technical assistance and education directly from national experts, including Dr. Bassett, who you just heard from, provided to our local Safe Babies Court team. That resulted in our court team liaison within the Child Welfare Agency, lobbying internally for a unified, evidence-based approach to these cases, not just for Safe Babies cases, but for all of the dependency courts in our area. Our longtime Safe Babies Court team community coordinator harnessed our network of community stakeholders and made connections needed to arrange a meeting between key members of the local opioid treatment facility and our child welfare agency, clear the air, reestablish a cooperative and supportive relationship. This in turn led to more conversations and to an extended presentation and question and answer session with the clinical director and other members of the treatment facility, and a large group of not just Safe Babies stakeholders, but the larger group of juvenile court stakeholders in our area, including judges, lawyers, social workers, and other professionals. That in turn led to further dialogue within and among the child welfare and treatment communities. For instance, there is now new cooperation between our drug treatment providers who only offer behavioral modification programming and the one who offers both that and medication-assisted treatment, so that our parents fighting opioid addiction can get these two equally vital components of effective treatment from more than one source. In the span of months, not years, we were able to break down barriers and raise substantially the competence of our juvenile courts in the largest population area in our state, in understanding and helping families before them who are embroiled in this crisis. I can't think of any other program, project, governmental agency, or policy that's better able to respond and affect change as quickly as my humble court, and because of its involvement with the Safe Babies Court team, the National Quality Improvement Center, and with the vital assistance, the education, and the guidance and action that they provide. I also believe this example underscores a couple of important points of having a structure such as the Safe Babies Court team and the QIC. So first, having this team structure in place enables the local court and the community to solve problems at the systems level quickly. Second, this is not a structure that was determined or put in place by the problem at hand, in this case, overwhelming substance abuse. Rather, it's a structure that was developed to respond comprehensively to the problems families and babies have. And therefore, it's prepared to tackle whatever those families bring with them, including substance abuse. Moving away from the example that my story provides to talk about the effectiveness of this Safe Babies Court Team approach in meeting the needs of drug-addicted parents in general, I can tell you some numbers. From the final evaluation report of the QIC that was completed last September by RTI International, from the data collected by our Safe Babies Court teams that are participating as demonstration sites. I can tell you, for instance, that for those parents in need of substance abuse screening, 91% received them. I can tell you that among those in need of substance abuse treatment, over 95% received treatment, either outpatient or inpatient. For substance abuse screening, the time from court order or referral to the service receipt was less than a week for 71.2% of the parents and 7 to 30 days for another 17%. The first substance abuse service, which includes inpatient with or without children and outpatient services, was less than a week after court order or referral for 73.8% of the patients and 7 to 30 days for another 11.3%. We expand that out to 60 days, you get to the whole 95% who receive treatment. These last numbers, concerning the time from referral to service, are particularly important for infants and toddlers in foster care, who scientifically and statutorily need to have a permanent home established faster than other children, with a clear preference for that permanent home to be with a parent. Again, I believe this demonstrates that having this team structure in place enables the local court and community to solve problems at the systems level. The problem here being the need to effectively address the treatment needs of drug-addicted parents and the young child's need for permanency.